we have a model here. This is a study done by Giteko, was in Kenya. Looking at the graph, looking at our histogram, there are two observations in this graph. The graph straight shows the proportion of malaria cases vis-a-vis maximum and minimum temperature. So on looking at the trend of temperature, particularly minimum temperature and the cases of malaria, you can see there is no relationship of minimum temperature in the case of malaria. Look at maximum temperature. There's some kind of a trend that is showing after every high temperature, there's an outbreak of malaria cases. There's an increase of malaria cases. Look at 1997. The data was taken from January 1997 up to September 1999. January, look at the high maximum temperature. After just high temperature, there's a relationship of outbreak of malaria cases. Look at January 1998. Just after maximum temperature, there's what? A time lag between temperature and malaria cases. So this means that for after every high maximum temperature, there's an increase of what? Malaria cases. So we can draw some theory or like conclusion that there's some kind of relationship with malaria cases and the temperature, specifically maximum temperature. So after measuring the long-term change of temperature and the forecast that temperature will increase in the future, that means we would expect to have a more increase of malaria cases at a particular incidence after high temperature. Let us now see other types of models that have been tried to estimate the future impact of climate change on malaria as a disease outcome. And this is under different scenario by 2080. What do we expect? Now, looking at different models, we expect that there will be an increase of malaria in East Africa, Central Asia, Asian Federation. This is according to model of Colin. And also decrease in malaria in Central America, Amazon, and with current vector limits. So it seems that where some regions there is an increase of malaria cases that is the outcome of interest, but in some regions there will be an increase of malaria cases. What does this mean? By studying climate and disease, we can estimate where much resources should be invested if the case of disease will increase, and where much resources should be drop down if the disease will decrease, or any type of outcome will decrease. So this is a type of public health interventions that we should put down to control the impact of climate on human health. Now, let us proceed and look at what other studies that have been detected the impact of climate on human health. It's a study done in Peru, Lima, trying to estimate the effect of temperature variation on diarrhea incidences. And now look at daily diarrhea admission and how temperature is changing. So there's some kind of variation between the daily temperature and the diarrhea admissions. So they conclude that by 1 degree increase in temperature, there is diarrhea case increase by 80%. Now, this information, what does that mean in terms of public health interventions? It means that if we forecast an increase of temperature by 2 degrees Celsius, so we expect increase of 16% of diarrhea cases, diarrhea admissions in our facilities. Now, if an area has been forecast to decrease temperature, it means that diarrhea cases will decrease. Now, in terms of intervention, we have to focus much where an area with high cases of admission will increase due to climate, and we project the resources, we project the human resources, fund, and the other public intervention to control a disease. So this is just one indication. What do we expect in the future? So throughout temperature recording vis-a-vis disease cases, we can estimate what do we expect if temperature will increase. This is another study done in Uganda, conducted in Uganda about cholera cases after El Nino. You see, look at 1996, 1997, 1998, up to 2002. 1997, there was high number of cholera cases compared to other years. What does that mean? And that was the year of El Nino when it starts. So after increase of rainfall, it means there is a massive destruction of public system, water supply, and other infrastructure that cause a lot of people being exposed to water and sanitation and fecal matter, and then increase of diarrhea cases. So you can see, now we can plan and see when do we expect to have our next El Nino, next cycle of El Nino. And if we do, we can say now, during El Nino, we have much impact on public health, then now, why should we stop now? Why should we plan for it? Why should we plan for intervention and adaptation measures in terms of investment in the cholera management? Those are some of the examples that can be obtained throughout reading, but you can study more in terms of Dr. Michael in terms of climate change and human health, risk and response, in terms of listed by WHO. We have another resource that Method of Facing Human Health, Vulnerability and Public Health Adaptation to Climate Change. Those are some of the resources that can help you to go in deep and study and have a deeper knowledge on how climate change affects your public health system. Now, after understanding that climate change affects the public health, what can we do? What data can we use to determine the burden of climate-sensitive disease? Remember, we have many issues. Health outcome. Health outcome may be a disease. Health outcome may be mortality, maybe disability, just life years lost. Any health outcome have a sensitivity to climate can be determined by using a number of data, number of disease sources, number of database, and so on. Now, what disease do we have? What source do we have? Now, question to be addressed. First, we must answer what are the climate-sensitive disease, or what are the climate-sensitive source of cases? What are the climate-sensitive health outcome? Now, you have to ask yourself, what is the current burden of disease, and what other factors should be considered when you try to assess? For example, sanitation, water, and so on. Where can I get those data, source of data for such disease? And can we be able to satisfy current demands? Our health services, our health supply system, is it able to satisfy the current demands of disease management in terms of supply of drugs, in terms of infrastructure, in terms of human resources, and so on? So after establishing that situation analysis, that we are going to put an adaptation plan. Now, estimate what will happen in the future. Then put down some intervention. So we have got always that source of data, WDS report, WHO database, we have Ministry of Health, and some other sources like Tanzania Meteorological Agency, Demographic and Survey, UNICEF. All of those are the source of data where most data available for particular disease health outcome, or whatever, mortality, morbidity, and so on. And then you try to estimate what are the current burden, what are the prevalence, incidence, what are the long-term change of those incidents, and try to forecast what will happen in the future.